Hi, my name is John Gravenstein. I'm a pharmacist living in Maryland. I also have a PhD degree in public health. I've been specializing in vaccines since 1983. Today, I'd like to help you get to know the COVID-19 vaccines. In December 2020, the United States started the most ambitious vaccination campaign in our nation's history. Over the next 9 months, 2/3 of Americans 12 years of age and older were fully vaccinated against COVID-19. That's almost 200 million people. America's pharmacists helped protect many of these people through vaccination. And now we need your help to reach the goal of having the remaining eligible Americans vaccinated as soon as possible, so we can get back to doing the things we stopped doing because of the COVID-19 pandemic. There are still many tens of millions of eligible Americans who have yet to be vaccinated. Some of them are in your community. As of early October 2021, the US Centers for Disease Control and Prevention, the CDC, recommends that all Americans 12 years of age and older get vaccinated for COVID-19 as soon as possible. COVID-19 vaccines are widely accessible in the United States and are available to people at no cost, regardless of their health insurance status or immigration status. The vaccine has already been paid for by the federal government. COVID-19 vaccines are safe and are effective at preventing COVID-19 disease, especially at preventing severe illness, hospitalization, or death. COVID-19 vaccines also reduce the risk of people spreading the virus that causes COVID-19. Vaccination doesn't stop transmission completely, but it reduces the chance for it. 3 vaccines are currently authorized or licensed in the United States to prevent COVID-19. It's helpful to understand some of the differences among the 3 available vaccines, and we will review each one in turn. Let's start with the Pfizer Biotech vaccine. This is a partnership of 2 manufacturing companies, Pfizer and BioNTech. The vaccine is also known by the name Comirnaty. The Pfizer Biotech vaccine was the first COVID-19 vaccine authorized and licensed for use in the United States. It is a messenger RNA vaccine, an mRNA vaccine. RNA is an abbreviation for ribonucleic acid. I'm going to describe what mRNA vaccines do. You can probably press the pause button for the presentation if you want to read the details on the slide or review any of the other facts that I offer. The mRNA in the vaccine delivers a bit of genetic code to our cells. The code gives instructions for our cells to make a single protein, a harmless piece of what is called the spike protein. The spike protein is found on the surface of the viruses that cause COVID-19. Our cells make the harmless piece of the spike protein for a few hours and then stop. The spike proteins are displayed on cell surfaces. The human immune system recognizes that that protein doesn't belong there and begins building a response that leads to immunity. The body starts making antibodies, like what happens in natural infection against COVID-19. The vaccine teaches our bodies how to protect against infection with the virus that causes COVID-19. So if you're exposed to the real virus later, your body will recognize it quickly and know how to fight it off. As of early October 2021, the Pfizer BioNTech vaccine is authorized for use in people who are at least 12 years of age. Studies of the vaccine in younger children are underway. The vaccine is given as a 2-shot series. You get an initial shot and then a second shot 3 weeks or 21 days later. You are considered fully vaccinated 2 weeks after that second shot. In clinical trials with people 16 years and older who got 2 doses, the Pfizer BioNTech vaccine was 95% effective at preventing infection of any severity, mild to severe, with the virus that causes COVID-19. This study involved over 43,000 volunteers, bigger than some other studies for other common vaccines. The Pfizer BioNTech vaccine was also highly effective at preventing COVID-19 infection in adolescents 12 to 15 years old. The immune response in those kids was at least as strong as the immune response in people 16 to 25 years old. As the mRNA COVID-19 vaccines got used more broadly across cities and states and countries, scientists found that vaccination produced similar protection in these real-world conditions as in the clinical studies, reducing the risk of COVID-19, including severe illness, by 90% or more among people fully vaccinated. The clinical studies for the Pfizer Biotech vaccine included participants of a wide range of ethnic, racial, and sex categories, and across a broad range of ages. The vaccine was shown to be highly effective in each of these groups, as well as among people with underlying medical conditions such as obesity, diabetes, and lung disease. Let's switch now to the Moderna vaccine, the other mRNA vaccine, also known as Spikevax. The Moderna vaccine is a messenger RNA vaccine similar to the Pfizer Biotech vaccine. It works in the same way by delivering a bit of genetic code to our cells with instructions for making that single protein, the spike protein, that's common to all COVID-19 viruses. As of early October, the Moderna vaccine is authorized for use in people who are 18 years or older. It's currently under review for use in individuals younger than 18 years of age. It also is administered as a 2-shot series. You get an initial shot and then a second shot 4 weeks or 28 days later. That's a little different than the previous vaccine, where it was a 3-week interval, but in this case, it's a 4-week interval. But just as with the Pfizer BioNTech vaccine, you're considered fully vaccinated 2 weeks after you get your second shot, your second dose. In clinical studies with people 18 years and older who got 2 doses, the Moderna vaccine was 94% effective at preventing infection with the virus that causes COVID-19. This study involved over 30,000 volunteers, again, larger than some other studies with other commonly used vaccines. The clinical studies for the Moderna vaccine also included participants with a wide range of race, ethnic, sex categories, and across a wide range of ages. The vaccine was shown to be highly effective in each of these groups, as well as among people with underlying medical conditions. It's important to know that the Pfizer BioNTech and the Moderna vaccines are similar, but the CDC recommends that you receive the same vaccine that you got on your first dose for the second dose, whenever possible. If you received a Pfizer BioNTech vaccine first, you should get the same product for your second shot. Opposite, if you received the Moderna vaccine first, you should get Moderna for the second shot. Now, let's talk about the third vaccine. It's a different kind of vaccine. It's the Johnson & Johnson COVID-19 vaccine. The vaccine is manufactured by J&J's Janssen Vaccine Division. Janssen is a European name, so you might hear people pronounce it as Janssen. It's the same thing. We'll call it the J&J vaccine for short for the next few minutes. The J&J COVID-19 vaccine is in a group that is the viral vector vaccines. And let me explain that. Viral vector vaccines use a modified version of a harmless virus, not the virus that causes COVID-19, a different one, to deliver important instructions to our cells to make proteins. This harmless virus is called a vector. And in this case, it's an adenovirus, which comes from a family of viruses that cause the common cold, but this vaccine can't cause the common cold. The vector enters cells in our body and then uses the body's own machinery to produce a single protein again, that same harmless piece of the spike protein that is found on the surface of the virus that causes COVID-19. The cell makes the harmless piece of spike protein for a few hours and then it stops. The spike proteins are displayed on the cell surface. And then just like with the other vaccines, our immune system recognizes that the protein doesn't belong there and begins building the immune response. It starts making antibodies, like what happens with natural infection against COVID-19. So what happens is the vaccines are teaching our body to protect against infection in the future. So if you're exposed to the real virus later, your body will recognize it quickly and know how to fight it off. You may have noticed that the main difference between mRNA vaccines and a viral vector vaccine is how they deliver the instructions to our cells to manufacture that same spike protein. The mRNA vaccines deliver the genetic material directly to the cell, and the viral vector vaccine uses the harmless, different virus to carry the genetic material inward to the cells. These technologies have been studied in people for well over 10 years now. As of early October, the J&J vaccine is authorized for use in people who are at least 18 years old. It's administered as a single shot, and you're considered to be fully vaccinated 2 weeks after that shot. In clinical studies in people 18 years and older, the J&J vaccine was 66% effective at preventing infection with the virus that causes COVID-19. When scientists focused on the vaccine's ability to prevent severe disease, the effectiveness improved to 85%. That may make you wonder, is the J&J vaccine less effective than the mRNA vaccines, or not as good maybe? The only way we can answer that question directly is if the vaccine had all been tested in the same way at the same time. The studies differed though, and that makes it challenging to compare them directly, like comparing apples and oranges. The main outcome in the studies of the two mRNA vaccines, the number one result they were exploring, was the number of symptomatic COVID-19 infections, the number of people who fell sick. The study for the Pfizer Biotech vaccine started counting cases of COVID-19 7 days after participants received the second dose. The study for the Moderna vaccine started counting cases 14 days after participants received the second dose. The main outcome in the studies of the J&J vaccine were moderate to severe COVID-19 illness only. The study monitored participants for both a positive COVID-19 test and at least one symptom, such as shortness of breath, starting 14 days or 28 days after a single shot. The study collected data for both time periods. Additionally, the clinical studies for the two mRNA vaccines were conducted before new virus variants started circulating in Britain, South Africa, Brazil, and elsewhere. The J&J vaccine was being tested in many countries when the variants started to appear. So the single dose J&J vaccine was shown to be 66% effective overall against moderate to severe COVID-19 infections from day 28 onward. That protection was different in the various countries where the study took place, and in the United States specifically, the J&J vaccine was 72% protective. And when the results were focused on just certain outcomes, scientists found 85% protection against severe disease. No one who got COVID-19 at least 4 weeks after receiving the vaccine had to be hospitalized in that study. As you can see, the clinical studies for the J&J vaccine had a more racially and ethnically diverse population than the studies for the mRNA vaccines. It was also studied across a wide range of ages. The J&J vaccine was equally effective in each of these groups. Neither the mRNA vaccines nor the vector vaccines can give someone COVID-19. You can't get the disease from the vaccine. Even though each of the vaccines delivers genetic material to our cells, they cannot affect or interact with our DNA in any way. Nobody's genetic code gets changed by vaccination. The material delivered by the vaccine does not enter the nucleus of the cell, which is where our DNA is kept. So let's talk about possible side effects. All shots hurt. How do the different vaccines compare in terms of side effects? In general, the most common side effects are the same for each of the vaccines. These side effects are similar to what's reported with other commonly used vaccines, and they are signs that your body is building protection against the virus that causes COVID-19. You may have pain, redness, or swelling in the arm where you got the shot. You may have flu-like symptoms, things like muscle pain, tiredness, nausea, chills, fever, or headache. These side effects may affect your ability to do daily activities, but they should go away on their own within just a few days. And some people have no side effects at all. The ones we've listed are just the most common ones. If you get an mRNA vaccine, be aware that side effects after your second shot may be more intense than the ones you experienced after your first shot. Not always, but sometimes. There have been some reports of serious side effects with both types of vaccines. Fortunately, these are very rare. The FDA and CDC and university partners are carefully monitoring for side effects. The public and healthcare workers are encouraged to report side effects to monitoring programs called vSafe and VAERS. Your vaccination provider can explain to you more details about these systems. Some people have developed conditions called myocarditis or pericarditis after receiving an mRNA vaccine. You can notice card, like cardiac in those words. Myocarditis is a swelling of the heart muscle, and pericarditis is swelling of the outer lining of the heart. Most of these cases occurred in male adolescents and young adults 16 years of age and older, so teen boys and young men, typically within a few days after vaccination. The cases have been reported more often after the second shot than the first shot of mRNA vaccines. Most people who developed this condition have recovered thereafter. Some people who received the J&J vector vaccine developed a syndrome called thrombosis with thrombocytopenia. Let me explain that. This means they developed blood clots, now that's the thrombosis part, but had lower than usual levels of blood cells called platelets that help your blood clot. That's thrombocytopenia. And so those two things don't usually happen at the same time, and it was a fairly unexpected and rare finding. Nearly all the TTS cases occurred in adult women younger than 50 years of age. More recently, there have been reports of people developing a nerve condition called Guillain-Barré syndrome, or GBS, after receiving the J&J vaccine. This is a neurologic disorder in which the body's immune system damages its own nerve cells, causing muscle weakness, or in the most severe cases, paralysis. Remember, these side effects of myocarditis, TTS, and GBS are extremely rare. Some of these conditions are also caused by the COVID-19 virus at even higher rates than after vaccination. In other words, if you wanted to avoid vaccination because you're worried about these side effects, you could have an even higher risk of the same side effects by getting infected with the COVID-19 virus. Experts agree that the benefits of getting the vaccine far outweigh the very small risk of experiencing a serious side effect. Let's be honest, there are still some things we don't know about COVID-19 vaccines. For example, we're still learning how effective the vaccines are against variants of the virus that cause COVID-19, such as the Delta variant you've probably heard about, that spreads so easily. So far, data show that the vaccines are working well at preventing the variants that are currently circulating. Not quite as well as against the original virus, but pretty darn good. And the more people who are vaccinated, the less likely that additional variants will develop in the future. So vaccination helps prevent variants in several ways. We are also still learning how long COVID-19 vaccines will protect people, and whether booster shots will be needed by some or all people. CDC recently recommended that people 65 and above, those living in nursing homes, and certain others receive a booster dose. You can ask your healthcare professional for the latest recommendations that apply to you. All right, we covered a lot of ground. Let's take a moment to sum up everything we've discussed. Two types of vaccines are currently authorized or approved and recommended in the United States to prevent COVID-19. The vaccines from Pfizer Biotech and Moderna are in the mRNA category, and that's messenger RNA. The J&J vaccine is a viral vector vaccine. If you received an mRNA vaccine, that's Pfizer Biotech and Moderna, you need 2 doses to be fully vaccinated. For Pfizer Biotech, the second shot is given 3 weeks after the first one. For Moderna, the second shot is given 4 weeks after the first one. And in both cases, you're considered fully vaccinated 2 weeks after the second shot. If you receive the J&J vaccine, you're considered fully vaccinated 2 weeks after the single shot. Vaccination reduces the ability to spread the virus to others. It does that somewhat, but not completely. You should continue to take prevention measures, such as wearing a mask and staying 6 feet away from other people. It's like in your car that has probably seatbelts and airbags. 2 forms of protection are better than either one alone. So vaccine is a very good shield, but it's not perfect. And so that's why we add on the extra measures, seatbelt and airbags. If you get the Pfizer Biotech or Moderna COVID-19 vaccines, it's very important that you get that second dose. You aren't protected fully if you don't. You may be asked to enroll in a monitoring system called vSafe. Your vaccination provider can provide more details, but it's a way to collect information from people like you, lots of vaccinated people, via smartphones to help us understand vaccine safety even better than we do today. After you're fully vaccinated against COVID-19, you can resume lots of activities that you did before the pandemic. We know being fully vaccinated reduces your risk of contracting COVID-19 in both indoor and outdoor activities. We also know that fully vaccinated people have a reduced risk of spreading the virus that causes COVID-19 to others. Vaccination continues to be the single most important step you can take to protect yourself and your community. I've been vaccinated against COVID-19, and my wife has, and all of my children, all 4 of my children, and all of our extended family. COVID-19 is a very bad infection. People are still dying of COVID-19 at too high a rate. They don't have to. We need more people vaccinated to stop the spread of the virus and to help keep these people healthy. Please get vaccinated as soon as you can and encourage others to do likewise. We've tried to answer common questions today. If you have more questions, be sure you ask your pharmacist or other healthcare provider for more information. Thank you very much.